but that the speed of that fall is slowing slightly. And this fact, and the fact that the pressure on the NHS has lifted somewhat, means that the UK Chief Medical Officers have agreed that the UK alert level has been moved down from level 5 to level 4, which is, of course, great news. But level 4 still means that there is significant pressure on the NHS. The number of cases is now falling by only 15% a week. In some areas of the country, that has flattened entirely, and 1 in 5 local authority areas has seen a rise in cases in the last week. I'm going to ask Professor Van Tam to set out more details of this and the geography in a moment, but I just want to say this about the figures. This stark picture shows that this isn't over yet. The stay-at-home rules are still in place for a reason. Every action that you take, every time you put your mask on, every time you stay at home, you are playing your part. This is on all of us to keep this under control. This is still a deadly virus. We will get through this, but we have to stick at it. We must all remain vigilant. And that brings me to the vaccination programme, because while the vaccination programme is rolling out at the pace of one of the fastest in the world, we're not there yet. We can all take comfort that through science we have found a solution. We've got a route out, and we will gradually be able to replace the protection that is there in the restrictions with protection that comes from the vaccine, and that is very good news. I'm delighted to be able to tell you that as of this morning, 19 million people in this country have had the vaccine. That's 35% of all adults across the UK. That also includes over 500,000 doses that were given yesterday, and it's easy for us to get used to these very large numbers. But that is 19 million people who are now starting to get the protection that we know comes from this jab. And we know that the jabs are saving lives right now across this country. And of course, the programme is expanding all the time. This week, we're bringing 10 more major vaccination centres on stream, including Towngate Theatre in Basildon and Reading Football Club. And I thank everybody who's continuing this expansion of the vaccination rollout. And these join our network across the country in cinemas and cathedrals, in mosques and museums, and so many other places that have been converted from whatever they do normally into these life-saving centres right in the heart of our communities. And we've seen this incredible enthusiasm about coming forwards too. As my colleague Derek Grieve, who heads up Scotland's rollout, told Her Majesty the Queen, he'd like to bottle the community spirit that we've seen, and I think we all feel that, and we can see it in the vaccination programme. And I'm very pleased to be able to tell you that today's data from the Office for National Statistics show 94% of adults saying they've either received the jab or they intend to do so. That is staggering. It's really, really good news that there is so much enthusiasm for this jab. And it's testament to colleagues who've worked so hard to build the confidence in the jab and make it as accessible as possible to people, which is what we're constantly striving to do. I'd like to give a shout out to Fazana Hussain, who is a GP in East London, who's been personally calling each of her priority patients, giving information about the vaccine and urging them to come forward and get jabbed. I also want to thank the whole team in Coventry and Warwickshire, who have delivered the highest uptake in the whole country, giving first doses to over 95% of the over 65s in their area. Thank you. It's an absolutely spectacular effort. This work is so important, and it's important because the fight back against this disease rests with every single one of us. And the more people who are protected, the safer we'll all be. So if you get the call, please come forward to protect yourself and to protect those around you. Now, throughout our vaccination programme, we've focused on protecting those at greatest clinical need, and this is the final thing I want to turn to. We offered a vaccine, for instance, to everybody in the top 4 priority groups by the 15th of February, and our current target is to get a first dose offered to everybody in the top 9 priority groups by the 15th of April. That's everybody who's over 50 or part of an at-risk group. Earlier this month, I asked the clinicians at the JCVI to set out what is the best order to offer vaccinations for the under 50s. I asked them to make this assessment based on how we can save the most lives and prevent the most hospitalizations. Earlier today, they published their interim recommendations. Next slide, please. The JCVI's clinical advice is that in order to save most lives, once we've offered the vaccine to priority groups 1 to 9, we should take an age-based approach and invite people to come forward in 3 further stages. First, people aged between 40 and 49 years old. They will be group 10. Then those 30 to 39, and then those who are 18 to 29. Who will become group 12. This is the fastest and simplest way to roll out the jab. Our moral duty is to put saving lives first, and that's what we've done. So I can confirm that we will follow this clinical advice. We will get jabs into arms as quickly as we can in the clinically recommended order. And once we've met the target by the 15th of April, we'll move on to these priority groups 10, 11, and 12. I'm sure that we all agree that the best approach is the one that saves the most lives. So that's what we're going to do together. And while we make this great progress on vaccines with one of the fastest rollouts in the world, we've all, though, still got to hold our nerve and do our bit. It's on all of us still to stay at home, to protect the NHS and save lives. Thank you very much. I now want to hand over to Professor Van Tam to go through those data in more detail.
Thank you, Secretary of State. I'm afraid I'm going to show you a couple of quite sobering slides now, and I'll explain why as we go through. First slide, please. So this is a UK map of case rates, and you can see it's a heat distribution from the darkest blue at 250 cases per 100,000 population per week, through to the lightest colours where we're getting below 50 cases per 100,000 per week. And what you can see on this slide is that there are still quite a few areas of the UK that are burning quite hot. And you can see that concentration in the Midlands and extending from the east to the west coast in a broad diagonal belt. You can also see some further hotspots in Scotland and Northern Ireland. So this is the first slide I wanted to show you, that although it is generally good news, I'm afraid it is better news in some places than it is in others, and this is not a battle that we have won yet. Next slide, please. At least as importantly as the rates of disease are the rates of change of disease. And these are 7-day rates of change through the, across the UK again, showing colours from white through to dark purple, where the rate of cases has increased in the last 7 days, through to from white down to dark green, areas where the rate of change has decreased. And you can see quite clearly, if you look for the purple and the dark purple spots, I'm afraid there are quite a few of them. And that does show that in some parts of the UK, case rates are changing, albeit slowly, but in the wrong direction. This is not a good sign and reinforces the fact that I'm afraid this battle at the moment is not won. Thank you. Now, I'll just continue, if I may, Secretary of State, with a few further remarks that relate to the slides I've shown you. As you heard from Secretary of State, we have now completed 19 million first doses of vaccine. We've given those first doses very successfully to cohorts, priority cohorts 1 to 4, and we're moving at some speed through cohorts 5 to 6. But these are first doses. People do need a second dose. And given that the totality of the cohorts 1 to 9, the priority cohorts, is about 30 million people, each of whom need 2 doses of vaccine, by my rough calculations, there are something like 40 million doses still to be given. So, much as it's encouraging, and much as I am really very upbeat about vaccines and how they are going to change how we live and what the disease is like between now and the summer, there is a long way to go. And my inbox in the last week has been besieged with people writing in saying, I've had the vaccine, essentially, can I now start to break the rules? Can I go and see my grandchildren? Can I do X, Y, and Z? And the answer to that is no. We are not yet collectively, as a country, in the right place. And all of the patients that I vaccinate, and they'll know it if they're listening on the TV, I say to them, and remember, all of the rules still apply to all of you and all of us until we're in a much safer place. It doesn't change because you've had your first dose of vaccine. And so, please don't be tempted to think, oh, well, one home visit might be all right now, weather's getting better, going to be a nice weekend. One small gathering in your house won't really matter. I'm afraid it does, and the data on the slides speak for themselves. So my kind of key message tonight is, look, this is all going very well, but there are some worry signs that people are relaxing, taking their foot off the brake at exactly the wrong time. It's a bit like being 3-0 up in a game and thinking, well, we can't possibly lose this now. But how many times have you seen the other side take it 4-3? Do not wreck this now. It is too early to relax. Just continue to maintain discipline and hang on. Just a few more months. Do not wreck this now. We are so close. Thank you, Secretary of State.
Thank you, Professor Van Tam, and for that clear, if sobering assessment. We're nearly there. Let's not blow it. The first question is from Emma from Worthing.
What plan do you have for supporting university students through your roadmap out of lockdown?
Thanks very much, Emma. It's an incredibly important question, and the roadmap sets out some of the details in terms of the return of universities to something more like a normal university experience. The answer to your question depends on the course that you're studying, and therefore how much you need to be physically present. There's some courses that have been running throughout, including with, of course, with COVID-secure arrangements, where people need to be in a lab or a medical school, for example. And then there's others, and especially art subjects, where it is easier to learn and to have that over Zoom or video conferencing. And so there is quite a lot of detail here, and the Department for Education have put out a significant amount of guidance. But of course, as with everything else on the roadmap, we've set out the indicative dates, but also we've got to be vigilant on the data according to the 4 tests that the Prime Minister set out. Final point, we have today set out the order in which we're going to vaccinate people, and people who are between 18 and 29 will come in group 12. So it is incredibly important for you to get your jab when it's your turn as well, because that will help not only to protect you, but to protect everybody around you as well. Thanks, Emma. Next question, Hannah from Belfast.
Why has the government removed guidance from last summer, allowing couples in established relationships not to socially distance from each other? And what would stop support bubbles being extended to allow couples to see each other again without limits on social contact?
Well, thanks, Hannah. We made the change that we did because as we went into the lockdown over the autumn in November and then again at the start of January, we wanted to make sure that we did everything we possibly could to stop this from spreading. And I'm absolutely sure that the actions that everybody has taken and the sacrifices that people have made have had that very, very positive impact. We do look, of course, at the support bubbles. We hold these all these rules under review, but the purpose of the support bubbles is so that people living on their own can socialise, because we know just how difficult it is to live on your own if you have no contact at all. So that's the reason for that support bubble. Thanks very much, Hannah. Next question is from Hugh Pym at the BBC.
Thank you very much, Secretary of State. The government says it's prioritising education in the weeks ahead. What do you say to teachers who argue that giving them priority for the vaccine could help reduce absences and disruption in classrooms?
Well, thanks, Hugh. The first thing I'd say is that we looked at all of these different considerations, and the JCVI looked at all these different questions, including, of course, the prioritisation according to different jobs that people have. But the overall view that we came to was that the right thing to do, the moral thing to do, is to make sure that we save the most lives. And the JCVI looked at the clinical evidence and also the evidence of how quickly, operationally, we can jab everybody. And that means that the clinical guidance from the JCVI is very clear that we should continue through the age range. And we also know from the data that, thankfully, teachers are no more likely to catch COVID than any other member of the population who goes to work. And so trying to come up with a scheme which prioritises one professional group over another would have been complicated to put in place, and wouldn't have done what we asked the JCVI to do, which I think is the right thing, which is to make sure that we minimise the amount of people who die by using the vaccine. I don't know whether JVT, you've got more details on this.
Thanks, Secretary of State. Hugh, I could just add a little bit more colour for you, I suppose, to say that the ONS data on the occupations with the highest rates of death begin with restaurant and catering establishment managers and proprietors, follow on to metalworking and machine operatives, food, drink and tobacco process operatives, chefs, taxi and cab drivers. I won't go on, but all of those death rates in the groups I mentioned are in excess of 100 deaths per 100,000 for males. If you look at teachers, and the ONS has now assembled some data on teachers for the period 9th of March last year to the 28th of December, the figures for male teachers, the figure is 18.4 per 100,000 for mortality, and that compares with an age average for a comparable age of 31.4. So if our objective is to save lives and reduce hospitalisations, then we have to start in a logical place. And if our objective is to prioritise by age, we would have to, by occupation, we would also have to start in a logical place. And you can see that is going to be very difficult because of the multiplicity of occupations that would need to be called forwards. And doing that is going to damage the pace of the vaccine rollout so much. And the big win actually is in speed. So the kind of message is really, when we're getting down into the phase 2 of the vaccine campaigns, it's more important to be in the queue worry less about exactly where you are in the queue, but be reassured that the queue is moving really fast and that you're going to get to the front of the queue because it's moving fast. And that's really, I think, the analogy that I'd want to kind of paint for you, that being in the queue is more important than where you are in it, and then making that queue move really fast is the key. Thank you, Secretary.
Thanks very much, Hugh. Next question is from Liz Bates at Channel 4.
Yes, thank you. So as you just set out quite starkly, different areas have very different rates of infection, it seems. That would suggest that as we come out of national lockdown, we might see the return of local lockdowns. Is that going to happen? Or is that something that you want to avoid? And can I also ask JVT if we can have a bit more detail on what's behind those regional differences?
Thanks very much, Liz. So we propose to come out of the national lockdown altogether. These regional disparities are smaller than we saw in the autumn. We don't rule out taking local action in an individual area if we see a spike, and I'll ask Dr. Hopkins to say a bit more about that. But the goal is for us all to come out together. What I want to stress is that these data show how important it is that we still stick at it, that this isn't over yet. And the fact that, 1 in 5 local authority areas across the country is seen cases rise in the last week demonstrates that we all need to stick to those rules and to do everything we can to keep this pandemic under control. I'll ask Dr. Hopkins to comment on that and put more detail on, and then JVT to answer your second question.
Thank you. So I think we are looking into detail at the differences in the regions. Some of the differences that we can see relates to the occupations and workplaces that occur. And as you know, we have increased workplace testing with lateral flow devices. I think it's really important that people come forward for testing in the next 4 weeks, so that it gives us the opportunity to find those hidden cases in communities and to allow the case rates to come down over the next 4-week period. We still have plenty of time in this time of national restrictions to reduce the case rates across the country. We'll also be working very closely with directors of public health and our regional health protection teams to ensure that we take local action right now. So we're not waiting for 4 weeks' time to see what happens then. And that's happening across the country right now with engaged teams looking at how we can find cases, contact trace in those areas and support people in isolation.
Thanks very much. And JVT?
Nothing to add, Secretary of State. Thank you.
Thank you, Liz. Thank you. Next question is Charlotte Ivers from Talk Radio.
Thank you, Mr. Hancock. We've had lots of calls from listeners this week who are raring to go to get their vaccines, but they're also a bit concerned and confused by the government's policy on vaccine passports. Are you able to give them a commitment today that they will never need to show a vaccine passport to get into the pub or to a football match?
Thanks very much. Well, look, this is an incredibly important subject. We know that there's some areas where certification is going to be needed. For instance, if a government of another country says that you need to show that you've had a COVID vaccine, obviously we then want to be able to help people, enable people to be able to show that certificate. But the wider questions have all been put into a review that, as you know, Michael Gove is leading. And I think it's best to allow that review to take evidence, to consider all of the broad range of issues, and then come to its conclusion. I'm sorry, I'm not going to be more specific than that. I don't want to fetter the discretion of the review, and I think it's right that we take our time to think about this. Thanks very much. And next question is Jonathan Riley from The Sun.
Good afternoon. To Professor Van Tam, there are reports today that school children as young as 5 are being told to wear masks in classrooms. Should teachers really be doing this? And is it really a necessity to stop the spread of COVID? And to Secretary of State, the COVID crisis has seen an outpouring of community spirit and volunteerism, including, of course, the Sun's Jabs Army campaign. Do you think these volunteers should be recognised in some way? And are you going to, or are there any plans to try and use this bank of volunteers after the pandemic to help our NHS?
Yes, two great questions. The Jabs Army marches on, and they're doing an amazing job in helping everybody to get the vaccines. And the voluntary effort around the vaccine rollout has been unbelievably brilliant. The number of people who've come forward, the enthusiasm that's shown, and I'm very grateful to everybody who's given up their time. We are looking at a system of NHS reserves, and the idea is that you have people who are committed to supporting the NHS through voluntary action, who have the training, for instance, and are on a specific reserves programme. And we're piloting that right now, but that's exactly the sort of thing that the Jabs Army might be called upon to do in the future in a broader sense, because we've just seen the unbelievable support that volunteers can give to the NHS when there's a big job to do. And I'll ask Dr. Hopkins to respond to your first question about masks amongst children. Thank you.
So I think the important thing to say is that we've looked and reviewed the data and the evidence on this. School children have the lower amount of infection, especially primary school children. And in looking at it, we've talked to educationalists, public health and clinical specialists. And the consensus view is very strongly to not advise school children at primary school age to wear face coverings. This is for two reasons. One is that they can have difficulties wearing them and keeping them on all day. And the second part of that is that it's really important that they can see facial expressions in order to develop their communications and language skills. Schools have delivered a lot of measures to reduce the risk in schools, and additional plans to test families of primary school children will also be in place as schools go back. And therefore, the strong recommendation is for primary school children not to wear masks.
Thanks very much. Anything to add, JVT?
My perspective on this is more parental than it is technical, and that is to say I just find it quite a daunting proposition to try and keep face masks on 35-year-olds in the same room. You know, I just think you should be concentrating on the teaching.
Thanks very much indeed. The next question is from Ned Simons at the Huffington Post.
Thank you, Health Secretary. Official figures show there are over 3.5 million NHS sick days in England due to mental ill health between March and October last year. But it's been reported that healthcare workers won't get a pay rise in the budget. What more are you going to do to support NHS staff other than asking the public to clap? And Dr. Hopkins and Professor Van Tam, if I may, last year's Eat Out to Help Out scheme was associated with an increase in transmission. Would you be comfortable with it returning this spring and summer?
So on the support for the NHS staff, this is an incredibly important question, and there's a huge amount of support being put in place to ensure that staff, especially those who've had a really tough time in this second wave of the pandemic, and who've had a tough time in many cases throughout the last year, to ensure that NHS staff get the R&R that they need. Of course, employment in the NHS is down to the individual trust, and there's a huge amount of work going on to make sure that people get the support to deal with traumatic experiences that they may have had. You know, I've supported in intensive care wards during the pandemic. I've seen the pressures that NHS staff are under. I know from talking to them what it feels like and the pressures that they've been under. Both the constancy of the work, the enormous amount of work that's had to be done, but also the fact that when you are dealing with people and the death rate is so high, that has a significant psychological impact. So we are putting in place that support to make sure that people who've been on the front line in what can be traumatic situations get the support they need, the professional support they need, as well as the HR support they need in order to be able to have that R&R and be firing on all cylinders again, and have that resilience. And then when it comes to the second question, JVT.
Yes, thanks for the question. I mean, I'm going to give quite a clinical answer, really. When you put people together to eat and socialise over a meal, over a table, as we all like to do, and maybe a little drink is also consumed at the same time, and the volume goes up in the place, of course, it is likely that there will be some transmission. But really, who pays the bill or how much of the bill you have to pay for yourself is not a medical question, and one for politicians and in particular the Chancellor.
Thanks very much. Final question is from Jim Scott at the Northern Echo. Jim.
Thank you. Here in the North East, we have some GP surgeries having to cancel vaccine clinics because they are not receiving the supply that they expected. One surgery in our region can't run clinics until March the 5th at the earliest because of lack of supply. We have huge rural areas that rely on GP surgeries for vaccines rather than the mass vaccination centres used in urban areas. Why are people in the north still having to travel more than 40 miles in some case to get their dose? And is this a sign that your vaccination strategy has been designed for the south? And just one question to Professor Van Tam. North Yorkshire Police are still giving out hundreds of fines for lockdown breaches as people travel to beauty spots in our region, including in some cases more than 100 miles. Now that the Prime Minister has set out his roadmap out of lockdown, are you concerned people now think the end is here and are less likely to stick to the rules?
So Jim, just on your first question, I'll ask Dr. Hopkins to come in, but one of the brilliant things about this vaccination programme is how it has been equal and fair UK-wide. And the North East has done a brilliant job in vaccinating. It came out of the blocks really fast and has done worked absolute wonders. And I want to thank in particular the volunteers and the NHS staff in the North East who have worked so hard to get these vaccinations done. And there has been a lower amount of supply across the whole UK in the last week or so. You'll have seen that in the last 48 hours that has picked up again, and yesterday we did over 500,000 jabs again for the first time in over a week. So that supply is coming back. We all know that it goes in, it's lumpy, it comes up and down, and we're going to have a bumper March. But I do know that there have been some vaccination centres that are so efficient, they've been able to use all of their supply, and I'm very, very grateful for the work that they've done. But the good news is that these challenges are faced equally throughout the whole of the UK, and I get people from brilliant local newspapers in the southwest asking the same question as you're asking about the northeast, and that gives me the impression that this challenge of the rollout is equally balanced. As far as I'm concerned, every single person getting their access to their jab in the northeast is as important as in every other part of the country, and we'll make sure that the programme delivers according to those principles. I don't know what more I can say about my enthusiasm for what the North East has done and really nailed it in this vaccination programme so far. Susan.
Yeah, I think that's exactly right. So the North East has been achieving over and above what the rest of the country has done. It's fantastic news. Everywhere is going to get vaccine, and everywhere will be able to deliver the vaccine to all of those from 1 to 9 over the coming weeks.
Thanks very much. And on your second question, JVT.
Yeah, thank you. Yes is the answer. I do worry that people think it's all over. The more they think that, when it's not, the greater the headwind they're going to give to the vaccine programme, and the more at risk will become the milestones set on the roadmap. And, you know, it's just a collective effort. It is actually up to us whether we can hold our nerve and see this through properly to the end of the roadmap, or whether we're going to kind of, you know, fall at the last furlough. Thanks very much, and thank you all for joining the daily briefing today. Once again, I'm going to end with where I ended the opening, which is to say that this is on all of us.
Of course, it's on us at the podium to do our duty and play our part, but it's on you as well. Every single person needs to keep sticking to those rules, stay at home, protect the NHS, and save lives. We're making great strides, but we're not there yet. Thank you very much indeed.
Parliamentary inquiry receiving evidence. And I can, as I pointed out earlier, I think in questioning to Andy Whitman, that this is not just about text messages in the SNP. This is also about government documents that this committee should have seen. You should have seen. I'm not talking just about the external legal advice. I'm talking about documentation that you don't have for about a 4-month period between late August 2018 and early January 2019. All the documentation you've got is virtually silent on that entire period. So You know, I don't think a parliamentary committee in these terms is helpless to say to the people who are not giving them the evidence, we want to have it. And of course, I think it was offered in one of, I think the evidence session from the investigating officer. She was asked that question and said she'd have a look and see if she could find it. Well, unless you've got it and not published it, I certainly don't see it. So I don't think you're helpless in this matter.
Well, when you mention Section 162, you have said that the Crown, specifically the Lord Advocate, has more discretion than has been used on some of these matters, which would allow to disclose to this committee material which you obtained as part of the criminal trial. Now, you've mentioned, I think you're mentioning the 2010 Criminal Justice and Licensing Act, which, as you say, was introduced while you were First Minister, and you have material in your written evidence in relation to that. I think my question is really that if that discretion exists, is it not the case that during the introduction of that bill, the government seemed to rule out introducing a power that would give them such discretion? So when the Act was in draft form, it included a Section 100, a provision that explicitly allowed exactly what you seem to be suggesting, the disclosure of evidence to a third party. But on the 4th of May 2010, at stage 2 of the bill, the government removed that section from the bill. Now, without getting drawn too far back into history about all of that, I appreciate. Do you understand why some people do not feel that the Crown has the kind of discretion that you are setting out and suggesting that it does?
Well, can I compliment you on your research, Mr. Allen? What I can tell you for an absolute definite, that legislation was constructed in the back of Lord Coulsfield's report of 2007. If you read Lord Coulsfield's report, you'll see exactly what the concern was. The concern was that witness statements were not being kept properly by solicitors. Presumably in these years, their filing cabinets were full up and they were appearing in skips all over the country. And there was also a concern that witness statements might be used for pernicious purposes by people to get revenge on people who'd given witness statements. This committee are not a third party. You are a parliamentary committee. You're a committee of the Scottish Parliament. You're not Joe Soap or Joe Bloggs. You're a committee which is there to find out and investigate and to do it in terms of the duty you have to the people of Scotland. You're not people who are not entitled to receive that information. And you say the Crown hasn't exercised discretion. That has not been the attitude of the Crown. I've got here the letters. 3 of them have been written to me and my lawyers. The first of which provoked by, we offered at the, I think it was the Assistant to Clerks, that we would, as opposed to giving you the evidence, we would set out which evidence at that stage you didn't have before you as a committee. And what we got from the Crown Office was a letter saying if we did that, they'd prosecute effectively. Then we got a second letter, just in case we hadn't appreciated the content of the first letter. And then finally, we got a letter which said, even if we responded to a request of the clerk, then not only would they consider us for prosecution, but they said anybody using that information would be prosecuted. The only way to read that is this committee. Now, if you think that would happen in terms of reality, I suspect it wouldn't. But the degree of effort of the Crown Office to prevent this committee from seeing evidence that it requested, not just SNP text messages, goes beyond any imagination. And then, of course, when they did provide you with messages, they provided you with messages that no committee could ever have published because they were outside your remit. Nothing I've ever asked of evidence to produce would involve divulging the identity of complainants. The people for which the evidence could come from the SNP were not complainants, and the government documents that are concerned here are matters that this committee should have had by right when you were promised the full cooperation of the government when you established your proceedings.
Thank you, Convener.
Thank you. Andy Wakeman. Thanks very much, Convener. Thank you for your patience, Mr Salmond. Time's moving on. I don't want to turn this inquiry into debate about the meaning of legislation, whether the Arbitration Act or the Criminal Justice and Licensing Scotland Act 2010, but I would just observe I have section 162 in front of me, and subsection 2 says the accused must not use or disclose the information or anything recorded in other than in accordance with subsection 3. And there's nothing in subsection 3 that allows you to disclose that information to a committee of the Scottish Parliament. So we can have a debate about the actual intention of that, but the actual act as passed seems to be very clear.
But I was only saying, Mr Whiteman, that you know, it's very unusual to have the person responsible for the act sitting in front of you, and therefore it's not just an observation. And I'm sure that if you wanted to check the matter with the then Justice Secretary and the then Lord Advocate, they would be able to inform the committee of what the intention was.
No, I don't doubt that that may well have been in the intention. All I'm doubting is that actual intention never made its way into an enactment. But I also don't deny the fact that the information you're talking about, Scottish Government documents, should be with this committee. I don't doubt that at all. They should be. I have no view on that. Can I just go back to your mention of the email, the affidavit of Anne Harvey that you mentioned? You have a view on the purpose of the email from Sue Ruddick, etc. And I don't want to rehearse that. You've made it clear what you believe the purpose is. But I just want to clarify that as a matter of principle, if I, for example, were a victim of an alleged crime and the police were investigating what I'd reported, do you agree that it would be legitimate as a matter of principle, setting aside the exact circumstances of this case, it would be perfectly legitimate for me to contact people who I thought were potentially the victims of the same crime because a police investigation was underway, and if they had any complaints, this would be a good opportunity for them to bring it to the attention of the police and make a complaint. That would be, in principle, a perfectly legitimate thing to do.
Yes, it would.
Okay, thanks. Can I move on to your...
In that case, you wouldn't be the person who was responsible within the organisation in terms of doing it. I mean, there's obviously a crossover between somebody pursuing complaints and somebody who's responsible for providing that information in the organisation.
No, I don't understand. I understand the specifics. You have a different interpretation of, but that was just an in-principle question. In your fourth submission to the committee, on page 2, you talk about the Parliamentary Committee has already heard evidence of activities by civil servants, special advisers, ministers and SNP officials, which taken individually could be put down to incompetence, albeit on an epic scale. However, taken together and over such a prolonged period, it becomes impossible to explain such conduct as inadvertent coincidence. The inescapable conclusion, you say, is a malicious and concerted attempt to damage my reputation and remove me from public life in Scotland. You've said that everything you say in evidence to us, in written evidence, that you can back up. Can I put it to you that there's nothing that we've heard that proves that this, in fact, is the inescapable conclusion, nevertheless, that such a conclusion may be consistent with these facts, but there's nothing actually that proves it. Would you agree?
No, I think the reason I set it out like that is, I mean, I can go through the various things if you like, but I mean, you know, I suppose if I was to highlight 6 things to you that you know, one would be the timing of the policy on former ministers, and the fact that, as has been said earlier, that 2 days before this policy started to be constructed, there was the query about Edinburgh Airport. I've already said that query came to nothing, and understandably so, but I don't think that was a reaction of the Permanent Secretary at the time. That was on, I think, the 6th of November, and the 8th and 9th of November, of course, is the first iterations of any sort of policy from 2 different civil servants, one who said he was starting with a blank sheet of paper, but there was another civil servant who also presumably had a blank sheet of paper. I'd have thought the open record meeting of the 29th or 30th November between the Permanent Secretary and the First Minister is significant. Basically because up until then, every iteration of the policy placed the First Minister in the policy at an early stage. But by the 5th of December, the policy had changed dramatically, so that the Permanent Secretary became the key decision maker. You know, this committee knows, that the Permanent Secretary had knowledge of the emerging complaints, certainly by the 22nd of November, and actually before then. Therefore, the very least you could say is that the Permanent Secretary put herself at the centre of a policy as the decision maker, with the knowledge that complaints were coming forward. That is the minimum conclusion you could draw from that. And it was a radical departure in terms of Scottish Government policy. I think, thirdly, the Crown Agent, as you, I think actually it was you in questioning the Permanent Secretary, you pointed out that what the policy says, under certain circumstances, the Scottish Government would refer to the police. It doesn't say refer to the Crown Agent. I think that is significant, and it's highly significant that the Crown Agent's attempt to give the Chief Constable and the lead officer a copy of the Permanent Secretary's report was declined by them because they said it might influence their investigation. And the decision, despite the information that was offered by the police, that they would be opposed to matters becoming public in case it contaminated their investigation, that despite that, it was the intention to release a press statement on the 23rd of August, 2 days later, which was stopped, of course, by the threat of interdict. The fourth point I would put, which is well known to this committee, is the question of the external legal advice, probably, as we know, on the 31st of October, and the extraordinary lengths that have been gone to prevent that advice being shared by this committee and the Parliament. We know that what was in the content of that advice, even reading it, was strong. We don't know the full extent of it, but certainly I think we conclude that the external legal advisers were telling the government at that stage that the prospects were not looking good, to say the least, for the judicial review. Therefore, what possible reason could there be for extending that action, which would be much, much more difficult when it came to court than it would be in an earlier concession, never mind the hundreds of thousands of pounds that are being wasted, unless there was a hope of the review perhaps being assisted, never coming to court, which is why it comes to be a major point in terms of the non-provision of assisting information. The fifth point I'd have, which is also which we've been discussing, is the question of the integrity of the investigative function. And my belief is that once the police start an investigation, then it's not for other agencies to be conducting parallel investigations. That is quite wrong. It's one matter to be assisting the police with their inquiries, which every responsible citizen should do. But you shouldn't be trying to assist them with inquiries to the extent of producing the evidence you're frustrated that the police can't find, or creating the evidence, or suborning witnesses, or pressurising witnesses, or pressurising the police, all information which this committee has. And finally, although the full extent of neither the government information nor the text messages known to the committee, we've already read out, and between Ms Mitchell and myself, half a dozen such messages which are in the public domain and which can be considered by this committee, because the one exemption there is in section 162, if you look further down, is that it exempts information which is in the public domain. Now, these 6 instances, I think, give you pretty substantial justification for what you've just read out to me, looking at them individually, but all 6, and perhaps another dozen that I could mention as well, but just taking these as the main themes. That, I think, is not an unreasonable conclusion. Obviously, my conclusion is informed by other material that I've seen.
Okay. Thanks very much for that. Again, on your fourth submission, I've just got 5 points should be dealt with a little bit more briefly. On page 11 of your fourth submission, you say, from a very early stage in the digital review, the government realised that they were at risk of losing. By October, they were told by external counsel that on the balance of probability, they would likely lose. Now, again, you've said that everything you write here can be backed up by evidence. What's your evidence of that, given that we haven't seen that advice? How do you make that conclusion?
Well, how do you prove advice hasn't been produced? I've not.
You say quite clearly, by October, they were told.
Yeah.
How do you know that?
Right. I'm saying that that is the case, and I've got every reason to believe that's the case, and I believe that's the reason you haven't been shown the external counsel legal advice. No, but I wouldn't be here saying it's the case unless it absolutely was the case.
Because you're speaking under oath.
I'm speaking under oath, yes.
Okay,
and that's the whole point of speaking under oath. And you won't be getting a correcting letter several days hence to correct that statement. I have every absolute reason to believe that legal advice on the 31st of October, as I understand it, but certainly about then, it indicated that on the balance of probability, the government were going to lose the judicial review.
Okay, and on page 15, can I ask you if it is on the same basis that you've just answered that question, that where you write, this information on likely defeat in the JR was communicated to key decision makers, the Permanent Secretary, First Minister, the Lord Advocate, the Chief of Staff, in meetings with external counsel through October and November 2018. So on the same basis that you've just told me, that you believe that to be true?
Well, and also the basis that you've seen from the Freedom of Information request,
sure,
the list of the 17 meetings, and you've seen the sequence of meetings, as you Paul Coquette indicated, it was read out earlier on, of that nobody was under any illusions about the significance of the information that had come forward. He didn't explain why it hadn't come forward, but nonetheless, that nobody was under any illusions. And the sequence of meetings with external counsel is set out on the FOI. And of course, the participants at these meetings, and you'll have seen that on free meetings running, the First Minister's Chief of Staff was there, the Permanent Secretary was there, and then the Permanent Secretary and the First Minister were there in early November 2018. So you have that evidence plus the evidence from the FOI and the sequence of meetings. What you don't have, of course, is anything from either these meetings out with the external legal advice itself. You don't have anything from these meetings or any of the daily meetings spoken about by Paul Coquette or any of the 3 times a week meetings spoken about by Judith McKinnon. I really think you should go and get them.
Well, it's not for want of trying, Mr. Salmond. We have, I think. Second last question. In the ICO, Information Commissioner Office report that you helpfully provided to us, which is an investigation, actually I understand it's an appeal or review of a decision, but nevertheless it's a detailed analysis of the attempt to ascertain why information in the decision report got into the public domain. And at 4.3, the author of the ICO letter, forgive me, I don't recall who it is, but it doesn't matter. It says 4.3, I have also considered the statement of Detective Chief Superintendent, their names redacted, helpfully provided by Levy and McRae. The statement confirms that at a meeting on the 21st August 2018, the police were offered a copy of the internal misconduct investigation report but refused to take it. Furthermore, at that meeting, DCS, redacted, voiced concerns about the SG, Scottish Government, making a public statement about the outcome of their investigations. So this statement that confirms these things, is this a statement that you have seen?
The proposed statement of 2 days later?
No, sorry, the statement of Detective Chief Superintendent, redacted.
Yes, it is, and it's a very interesting point you just raised, because of course that is an exemption to section 162. The reason that we were able to give the ICO a copy of that statement is because the Crown Office permitted us to do so. So we've just had a discussion, and congratulations for pinpointing the point as to whether this parliamentary committee was entitled to see information under 162. That statement was provided for the ICO with the permission of the Crown Office, in itself an exemption to 162. So the idea that was put forward a few seconds ago that the Crown Office has no discretion in these matters, well, clearly they found discretion as far as the ICO is concerned. And let me say, no complaints about that. That was exactly the right thing to do, to provide that information to assist the ICO in its investigations. My argument would be it would also be the right thing to do to assist a parliamentary committee of the Scottish Parliament.
Okay, and just on that, the reason for asking that really was due to my own ignorance as to whether this committee has that statement. To your knowledge, has that been disclosed to this committee?
No, it was disclosed to the ICOs.
Do you have a copy of it? Levy and McRae?
Well, Levy and McRae have
Would you be able, were this committee to ask you, or to ask Levy and McRae, would they be able to provide it to this committee?
Well, not according to the Crown Office.
Okay, thanks.
We can certainly say we'll get the fourth letter telling us what we can and can't provide to a parliamentary committee. But the ICO investigators report, as you know, is very revealing, and I raised earlier the apparent discrepancy between what's said in this report about who had access to the information in terms of the Principal Private Secretary in the First Minister's office and what has been said and then corrected to this committee, which I think is worth pursuing.
Thanks. And just finally, this goes back to questions from Jackie Bailey about whether meetings on the 2nd of April, for example, and subsequent ones were by the First Minister were in a party capacity or government business. Can I put it to you that there's a third possibility here, that actually the subject matter of these meetings was complaints by civil servants against a former minister as part of the employment process you disagree with and all the rest of it, but nevertheless a complaints procedure in the civil service. It's not really party, and neither is it really government. Government is about the government's policy on housing and independence, etc. I'm just putting it to you, there's a third possibility that because this is a sort of internal employment matter, that it's not quite as stark as being party or government.
But you can put that to me, but that's not been the point I've been making about the meetings. What I've said about the meetings, there was never any doubt about what the subject matter was. It's up for others to explain, as they've been trying to do in front of this committee, as to whether they thought it was a party meeting or a government meeting. My point is there was never any dubiety about what the meeting was about. And in my view, there's no dubiety about the meeting on the 29th of March, which set up the meeting on the 2nd of April. And there's no dubiety that the 29th of March meeting somehow disappeared from the public record for an extended period until the fact of it was broadcast on Sky Television in July of last year. That's the questions I'm asking. You could put any construction on whether that's a meeting of one or a hybrid meeting or whatever it might be, but that's not been my point. It's maybe a point that others have developed, but not me.
Okay, thanks very much, Convener.
Thank you. We're almost at a close. I have Maureen Watt and then Margaret Mitchell, both with short contributions.
Thank you, Convener. Mr Salmond, you said in your written evidence that you support protecting the anonymity of complainers and that this is something that you've had upheld at every stage in this process, yet you've provided material directly to committee MSPs, some of which has then leaked into the public domain. There is a process that evidence goes to committee clerks so that it can be scrutinised by committee lawyers. It's not up to you or your lawyers, it's up to committee clerks and committee lawyers to decide what should go to MSPs and whether there's a risk within the material that there could be identification. So what was your motivation for not following the correct procedure, which was designed to protect the identities of complainers in a criminal trial?
Well, let me firstly refute absolutely that anything we have done or published or sent questions the identity or anonymity of complainants. And I've already given you the example in what's under your purview in terms of the remit of the committee, in terms of the civil case and the efforts we went to protect that anonymity in the Court of Session hearing where the government didn't bother to turn up. But in terms of the argument that we shouldn't send stuff to members of a parliamentary committee and somehow that's an irresponsible thing to do or not the right thing to do, I don't accept that. Every single member of this committee has their duties and responsibilities as a member of the Scottish Parliament. They're equal before this committee, and that is not sending to a parliamentary committee. What I thought was interesting that when Kenny McCaskill sent this committee information that he had received and sent it to the Crown Office, nothing happened with that information. it wasn't until it was published in the press that it became public, and therefore was, and to me that was an extraordinary situation to develop. But I don't think, to answer your question, Ms. Watt, that it's a wrong or irresponsible thing to do, and I refute absolutely that anything we've submitted to anybody puts a question mark on the anonymity of complainants. And furthermore, the one paragraph that the Crown Office objected to, and I know you follow these things closely, was objected to not on the basis of being jigsaw identification in itself, but on the basis of information which had been previously published by this committee, which led to the jigsaw identification. Now, these arguments can get very technical, but what is beyond argument is that 2 weeks ago, the Crown Office did not consider anything in the submission that was made to this committee to be in danger of breaching anything. And for some reason, earlier this week, on the very point of coming before the committee, there was a change in position. Anybody who has seen that evidence, and everybody who's seen that evidence, cannot understand why anything in that evidence gives rise to a risk of identification. These things are there correctly to protect the vulnerable, not to shield the mighty.
Can I just remind everybody again that that would be an issue for the Scottish Parliament corporate body rather than this committee? Margaret Mitchell.
Yeah, thank you. And these are my final questions, Mr Salmond. I don't know if you're aware, but the committee wrote to Police Scotland and we got information about the contact that had been made with them during the policy being developed and actually that 3-month period. And I think Police Scotland were told there were actually 6 meetings between first a contact on the 5th of December 2017 right up to the 3rd of August. And hypothetical questions were put, and the police quite clearly said, without knowing any details or hypothetical things, if criminality was suspected, individuals should be directed to support and advocacy. They also went on to say that this advice was reiterated on several occasions, and they conclude by saying really that if there was, if the Parliament was seeking to investigate themselves, they clearly were not qualified to do so. They didn't have the training. So that was before the final policy was concluded. So I suppose my question in going back to Stuart McMillan is duty of care for these women who had come forward. We know they didn't want to go to the police. That's been substantiated in evidence. The sounding board and the duty of care absolutely is something you would want to put in place, but there was a real intensity of contact with women, and I think it may have been your solicitors that said that may have been bordering on encouragement. And if that is the case, then the question is, for this plan, this malicious plan that you've outlined to discredit you and remove you from public life, if this was in place, the big question is, what was the motivation? Why? I think that's what everyone was asking. Just why did they do it? It just seems, so bizarre. But do you have a reason why you think that this process started and perhaps got a bit out of hand?
I think motivation changed over time, and just for clarity, I've never suggested for a second that the original complaints and complainers were anything to do with a motivation about me in politics or anything like that. I don't think that anything to do with it at all. I think the complainants were incredibly poorly served, as you just outlined, by being forced into a criminal process against their direct wishes and against every assurance they'd been given over months that that wouldn't happen. I think it was Judith McKinnon who was asked, who asked you to sound them out? And she said that she thought it was Nicky Richards. It wasn't, it was the Permanent Secretary. And the consequences of that for the people concerned are huge. And it's totally wrong, completely and utterly wrong. I think the motivation for what I've said about the people I've named in the document is quite different. I think it came to be believed that the solution to a huge, looming, enormous difficulty and problem wasn't to just, as I'm sure the Lord Advocate did, to consider assisting as an academic exercise or something that might have to come into play, but was actually a means of preventing something something unfortunate, more than unfortunate, something disastrous happening in terms of a defeat in the judicial review. The two things became to be combined. It became to be very important that the criminal case overtook the judicial review. And the messages I've seen indicate that as a prime motivation. So when I saw them, and I think it was the 23rd or maybe earlier of January last year, I found them extraordinary, probably the most shocking thing I'd ever seen in my life. Unless it was there in front of me, I couldn't have possibly believed it. So these people, if they ever came before a committee, should be asked about their motivations. But certainly what they revealed of themselves in these text messages would indicate that was the prime concern, was defeat in the judicial review and the idea that somehow the criminal case would either overtake it or alternatively, after the judicial review was lost, a criminal case against me, as of course, would blanket out all other publicity. It would be the most enormous story. And if I had been convicted on anything, then, as I've said earlier, we wouldn't have been having these hearings and nothing would happen. So that would what I'd point to as motivation.
Right, so there wouldn't be any motivation, I think it's been thought about, that you are a private citizen, that you might be contemplating a return to public life, and that by moving forward in this way, where there were so many times they were told the procedure was unlawful, they were told they weren't qualified to carry it out. If they had serious concerns, they should be directed to advocacy. They weren't trained, the government staff weren't trained, but they persisted, and they persisted with the judicial review to a point that just defies comprehension. So is that just absolute incompetence from people who are civil servants, well qualified, gilt-edged pensions, there to be impartial, in which case then that's deeply worrying? Or was there something else behind it? What was your relationship with the First Minister over years?
Firstly, I don't think the civil servants had a political motivation. I think motivations lay elsewhere in the case of the Permanent Secretary. And I've seen previous evidence sessions where there are documents which suggest that her motivation was being seen to be in the vanguard of events, perhaps. But you have to ask the Permanent Secretary again exactly what her motivation was. In terms of not conceding the judicial review, then I think you're absolutely correct. I mean, if the judicial review had been conceded, for example, let's say October, then the bill to the public would have been very small in comparison with what it became. The huge bills came from having to go to the Commission in diligence, like 2 days before Christmas, as it sat, and people came under oath. So any calculation that said, we are going to lose this, and what's the best thing to do? Well, it would be to settle it as quickly as you could and to minimise the damage, unless, of course, you believed for some reason or another that the judicial review might never come to court. It might be sisted into the ever after by the events in the criminal case. And my belief, strong belief, is that some people, unfortunately, weren't willing to let matters take their course, but wanted to give the criminal case a big shove forward. And the messages I read were one of the most distressing days of my life.
Thank you.
Thank you. Can I just ask, Andy, was that you saying you wished to come in?
I just have one very short question.
Very short,
whenever,
please.
Now? Okay,
yes.
Thank you. Mr Salmond, do you have full confidence in the independent advisors on the Ministerial Code? And thus, can we rely on Mr Hamilton's findings as an authoritative statement of the facts and circumstances that he's been asked to look at when they're published? One,
I set up the system. Two, I appointed Mr Hamilton. I should say I never met him in my life, and I've only corresponded with him recently. I'm being interviewed by him, I think, on Monday or Tuesday, certainly in the very near future. I've got every reason to believe that he is a man of great integrity and experience, and is the sort of person. Well, I did appoint him to the panel, so. The panel, of course, was introduced by me. Before that, there was no independent supervision of the Ministerial Code at all. And the panel, I think, has been a good innovation. The one thing I would say from recent experience, and you've seen the correspondence, is I think it's heavily unsatisfactory that the remit should be confined in any way. I mean, the remit should be determined by the independent panelists, not set in strict terms. And I hope and believe that that problem has been overcome. But I've got every confidence that Mr Hamilton will discharge his duties in a proper way, and I think it's fundamentally a good system.
Thank you.
Right, I'm going to be very strict from now on. Jackie Bailey assures me with great intent that it's a tiny question. And can I have a tiny answer, please, Mr Salmond, if at all possible?
It is indeed a tiny question, Convener, I do promise. Mr Salmond has been very, very careful not to call for Nicola Sturgeon to resign. Does that mean you've forgiven her for her handling of this?
No, it means that the people I've named and the evidence that I put forward, I believe there's documentary evidence for the reasons that they should consider their positions. Whether you call it careful, whether you call it anything else, I don't think it's for me to judge what happens to someone who may have broken the Ministerial Code. If they have broken the Ministerial Code, if Mr Hamilton finds that, or this committee finds that, then I suppose the next question is, what is the breach? And then that will be determined. But I'm in the fortunate position as a former First Minister, that is no longer my responsibility. It's partially the responsibility of this committee, substantially the responsibility of Mr James Hamilton, and all of the responsibility of the Scottish Parliament.
Thank you very much, Convener.
Thank you. I have only one final little thing I wanted to ask, following up from what Margaret Mitchell was talking about. There has been a lot of discussion, obviously, and the word conspiracy has been used a lot, although I do note, Mr Salmond, that you said that that's not a word that you wanted to use. You talk about a malicious plan. From what I've picked up today, you've said repeatedly about your concern about this being after the police investigation has started. Can I just ask you to confirm to me, is that when you believe any plan started that was, what could we say, malicious towards you in its intent?
Yeah, I mean, yes, that is my view on the nature of what I've seen. And it became because of the circumstances that I've described, because of what was going to happen in the judicial review, and the hope that the police investigation would come to the rescue of that. I've got many parts of information. I would just say to you that almost happened. That very, very close to happening, not just in the time of the police interview, but the original date for the police interview came before the judicial review was due to hear, and it was only with the great work of my legal team that we were able to argue that shouldn't happen. So that almost came to pass now. We're in a position that we're in a position that the court and jury have decided, and therefore the matters before you are now very pertinent in the public interest again. But yes, the broad answer to your question is correct.
Thank you. Now, can I ask you, Mr. Salmon, do you wish to make any final comments?
Only one.